Hi, my name is Erin Maughan, and I'm the Director of Research at the National Association of School Nurses. I am thrilled to spend a few minutes today highlighting the results of the Northeastern Pennsylvania School Nurse Needs Assessment. Research has shown that school nurses do make a difference in academics and keep students in school. However, we realize there are gaps and barriers that do make it hard for school nurses to do this, and that is why we conducted this gap analysis process. You can see what the process is on the right, highlighting basically what I'm going to share are the results, but we conducted a survey of, sent the list out to all school nurses and pupil services directors, received 131 surveys back, which we estimate to be about 50 to 60% response rate, and most important, participation from all 11 counties, which is fantastic. We also conducted interviews with community stakeholders to make sure we got educators and community stakeholders' perspectives, and we then conducted also some large face-to-face meetings with school nurses. The results showed that school nurses are oftentimes forced to spend the majority of their time doing individualized care of students, as well as screenings and focusing on documentation requirements. This consumes their time and they're not able to do other things. And the other things I'm speaking of are the gap that we found compared with the standards of practice, which that picture shows. The school nurse of the 21st century does more than what they did before because the complexity of students has changed. And what we found was that school nurses even knew this, were that there's a gap in population-based care. That's prevention, a culture of health among the entire school. It's kind of the multi-tiered system approach that educators understand. That tier 3 of universal, that's population-based care. We also found that school nurses needed more time and they saw more emerging issues coming up, COVID, mental health, and yet needed more professional training and would like to address those more. They also did a lot of the screenings, which are mandated, but not able to do the follow-up care that's oftentimes needed in coordinating things and connecting with communities. So we know that this was the major gap, but the question is why? And we identified 3 barriers that we felt were causing this gap in care. The first one is outdated policies and procedures. Pennsylvania has many mandates on the books for school nurses to do, and which can be really good, but many of them were outdated. For example, scoliosis screening. In addition, at all levels, oftentimes procedures or policies were outdated or didn't even exist, and there wasn't a process to review them. We recommend every 5 years, all of them should be at least reviewed and updated so they stay current with current needs. Again, these was causing school nurses to be able to focus on these mandated activities and not some of the other activities that were needed for the current day and the current situation. The second barrier was misunderstandings and disconnections, particularly with educators, parents, and community stakeholders. Due to this complexity and the role change of school nurses, it wasn't always understood, particularly by educators, that this population-based approach that is an important component of school nursing. They also didn't realize, educators, that school nurses do and address mental health concerns, actually quite a bit. Some statistics show up to 1/3 of what they see are mental health concerns. There also was a disconnect in what school nurses do for staff health needs. From the community stakeholder perspectives, the disconnect was that the community stakeholders knew that school nurses did screenings and referrals, but thought that was about it, and didn't realize everything else that school nurses did and that they're stretched pretty thin. There's also causes where community providers want to come in and help do different things. They didn't realize that there might be duplicating what school nurses were doing or weren't coordinating efforts, which kind of makes a hodgepodge and still were gaps in other things that needed to be addressed. The final barrier was resources. We recognize that schools' budgets are tight, and you guys do a great job on stretched budgets, but there are also maybe some resources that were kind of lacking or hard to find. More investigation is needed, particularly regarding substitutes for school nurses. And then I mentioned the community providers and the stakeholders. A strength was all the community providers, but sometimes there was duplication or other areas of gaps, and doing better at the coordination and collaboration of those things would really be helpful and is causing a barrier. So I know it's a gap analysis, but I have to end with the strengths, which is the school nurses. And despite the barriers and gaps, school nurses are doing an amazing job. They're in a unique position, oftentimes the only medical professional in the school or the only one that kids see due to access or insurance problems. It's really great that in Pennsylvania there are certification requirements for school nurses, and I think making the certification more consistent will also help with the role of school nursing. To summarize, many potential ways to support the further work, which are found in the report and Moses Taylor Foundation strategy, and it consists more than just hiring more school nurses. We just want to say thank you for the opportunity to share this, and also that together we can address not only the immediate needs, but really improve the health of the entire community, because students are an extension of families and they are our future. Thank you.